Now I'm going to demonstrate the wood inflammation points. Wood inflammation points are always done side opposite the liver. Wood means liver. Wood means wood element in the name. There are the wood anger points, which we've talked about already, found on the index finger, which are more for liver-qi congestion. The wood inflammation points are located on the ring finger, and they're for serious liver pain. We are not talking liver-qi congestion here. We're talking liver cancer. We're talking cirrhosis, serious liver hepatitis, serious liver disease. Can be very painful. So we want to remember that we're always going to be on the left hand opposite the liver. Okay, these points are found on the middle phalange. On what we call the D line. So the midline is the C line. The side, the red and white skin, would be the E line. So in between the midline and the red and white skin is the D line. And these are located on the D line, middle phalange, ring finger. When we're measuring, we always take the bottom line to measure from. So 1/3 the distance would be here and here. We want to look carefully for blood vessels because there are often blood vessels, and when you're needling you want to avoid those if at all possible. So we look for the pink areas. She has a little blood vessel coming down right here, but that's not going to be in our way. So I'm going to pick this pink spot. We could actually even go with the crease because it's desensitized. I think I'll use it for that reason. Desensitized by pressing the tip into the skin and just giving a little depression, and then without bouncing, kind of right through the surface. Then we take it down to the level that we want it, kind of bouncing it in, not as a form of stimulation or special technique, but just to check and make sure we're not getting hung up on a tendon. Then we need to be careful of that needle, so I put that needle inside my finger as I'm needling for the second point. Desensitize the surface, little just to get it in, and then take it down. Now I felt the pressure of that needle tip coming into my index finger on the back, so that's how deep it needs to go. We don't want to go any further. We don't need to poke it out in the back, so I could feel it there. These are the wood inflammation points used for real liver disease. When you take out a needle, always cap your points and pull out from underneath. All right. Thank you, Marcia.